Hi, everybody. Today's training is going to be on understanding parent-child interaction therapy principles and how it can be applied in ABA treatment. We have Corinne Falgares here with us. She used to work at our KidsPeace outpatient program for 9.5 years. She was trained in PCIT in 2014 and has been an LPC since 2012. She is currently in a private practice practicing PCIT and other therapies at the Hope and Wellness or Hope and Healing Wellness Center. We're very excited to have Corinne with us today. And just to remind everybody, this is being recorded, and we want to not talk about any client specific questions, but if you do have questions, you can throw them in the chat and we'll be happy to answer them. So I'm going to let Corinne take off.
All right. Thank you for having me. Hello, everybody, even though I can't see anybody, but thank you for having me and joining. All right. So some of the objectives that we'll kind of get through today are just understanding PCIT and its skills, because a lot of the skills that we do in PCIT are very similar to what you do for the ABA. Understanding how they can be implemented in BST, and then understanding how these skills can improve interactions between the caregiver and the child. It also is going to be skills that you can utilize between, colleagues, but then also with therapists or BSC, and the parent as well. So a little bit of everybody can utilize these skills. So the ABA and the PCIT are both effective treatments in helping improving, the child's social and behavioral skills. It's a lot of behavior modification that we utilize. The difference with PCIT, it's a very in the moment live coaching that we're providing to the caregiver. So in a sense, what I tell families is that I am making the caregiver become the play therapist. I'm teaching them exactly what a play therapist would be doing with their child. But the important thing is that the parent or the caregiver and the child are making those improvements in that interaction. So I'm literally the bug in their ear to communicate with them on what to respond to, what not to respond to, and what to say with their child in order to improve behaviors. We can go next. All right. So PCIT, it's empirically supported treatment. Sheila Iberg is the creator of the PCIT program. It is internationally used. It is across the world. It's so fascinating to join some, meetings, with people from all over the place, and how this treatment can be utilized, with all populations and cultures. It is specifically what I'm trained for and then utilizes for children 2.5 to 7 years old and their parents and caregivers. But there are many other providers that also do it with early childhood. So from, 6 months, I think some do it, all the way to 2. And then also for older children, PCIT. There also is specific PCIT training for ASD. So it is well, known and utilized across, and just making different adaptations to the treatment protocol in order to meet the family and the child's needs specifically. So it's really a fascinating program because it's teaching the skills. The other thing that is really awesome about it is it's time sensitive. So it's not going to be lifelong treatment. I know sometimes with your program, you can have kids in the program for years. PCIT, we have certain criteria that you are meeting in the treatment. And so once that's met, they graduate. So it's not forever, which is a nice, way to get the families to agree to starting because they know it's not going to be forever. Obviously, it can go long. I don't usually have families get done in the 14 weeks that it can be done in because I am collecting data every single session. And so if they're not making improvement in their skills, then we will keep going. So I'm not going to say, hey, you're at your 14 weeks, you're done. We can keep going. So a lot of times families will need to go longer in order to build that confidence and maintain those skills. If you do the program, families withhold and or keep up those skills, and we see the children having those improved behaviors up to 8 to 10 years past the treatment time. So if you're getting, a kid at, 6, we're going all the way into those pre-adolescent years, which is great because that's where a lot of behaviors come out again, for these kids. So as long as they keep these skills, then we will see improvement in that parent-child interaction. Next. Oh, there we go. Okay, so PCIT has 2 main goals. The first is enhancing the relationship between the parent and the child. So this is the part of the program where we are really getting them to engage and interact with one another in order to improve the child's behaviors. So a lot of times we'll get referrals for children who are defiant, not listening, don't like the word no, and become aggressive, have temper tantrums, sassing their parents, just feeling overwhelmed by being able to manage their child. A lot of times it's more in the home setting because they'll say, oh, they're fantastic at school or at, daycare. And so what we're doing is we're enhancing that relationship between the parent or the caregiver and the child. Once we have an improved relationship, which I explain is like we need a really solid foundation to build the house. And so once we have that foundation built, then we can then start to address some of the other behavior modification that parents are looking for in the sense of discipline, right? I just want them to listen to me is a lot of times what they'll say, or they just need to do what they're told. In PCIT, in order for a child to listen to what they're being told, we need to have a good relationship. They need to respect you. And so the first phase really enhances that, improves their self-esteem, improves their social skills, it improves their ability to share or enjoy play and interacting with that caregiver. And so then when they're doing that and we move into the second phase where we promote more of that behavior management, then we will have a higher degree of compliance where the child is going to comply with the parent because they're enjoying that relationship with them and it's not that power struggle anymore. Next.
Oops, sorry.
Let's go. If I'm going too fast, please stop me. Okay. Sometimes I know I can talk too fast. All right. So there's 2 interactions in the PCIT model. And so there is the child-directed interaction phase. So that's that first phase where we are, promoting that relationship. This is very play therapy based. So we're going to be having the child and the caregiver engaging in play in order to strengthen that relationship. So the great thing about this part is that the kids are in charge. They get to decide what they're going to play, how they're going to play, what they're going to build, their creativity level, and the parent or caregiver just needs to follow the lead of the child. Then once we build a strong foundation of that, and there's certain skills that the parent or caregiver meet in that first phase, then we move into the second phase of treatment, which is then that parent-directed interaction phase. That's then where the parent can give those commands and then the child needs to comply. Once they comply, they go right back into that play and we do CDI. So it's a lot of quick flip-flopping from CDI to PDI, CDI to PDI. And so that just is really building that foundation. PCIT runs through a protocol. So every session is very structured in what it is that we're doing. And so when we start, we do a teach session, which is basically what I'm going to be doing with you guys today. Then we would do our coaching sessions where then I'm going to be giving the parent direct coaching as they're interacting and engaging with their child. Once they meet criteria of mastery, what we call, then we would have another teach session to go over the parent directed interaction phase and how that looks. And once that they go through those sessions of coaching and practicing the skills and they meet mastery, then we have a graduation. So it's a lot of teaching the family the skills and modeling and role playing with them. Then they're going and practicing and we're providing that direct support for them. And then they're maintaining those skills. We also utilize an assessment tool that allows us to track every week how the parent is feeling in being able to manage their child's behaviors. And so they can report every week on how they're feeling the behaviors occur and whether or not they feel confident in managing those. And so in the treatment within like the first 2-3 weeks, we will see a major decrease in those scores. And then there's a certain score level we want to see in the standard deviation to then notifying the parent that the child is within the standard deviation or within normal behaviors for their age. And when they're feeling confident, we then move them on. Next.
This is actually time for our first code word. And the first code word is play. So that is first code word, play.
I forgot. How many code words are there? 3?
3, yes.
Okay. All right. So the first phase, the child-directed interaction, or CDI, like we like to talk to about it, is, like I said, the parent is learning to follow, right? And so this is where the child is taking the lead. So this is the really interesting phase of treatment, because we have to kind of reteach parents how to play and be a kid, how to just enjoy spending time with their child and navigating play again, seeing how creative they can be with building, alongside with their child. So the first thing that we teach families is to avoid, or what we call, our don't skills. And those are, we are avoiding during this interaction and during these times of play, avoiding commands, questions, and critical talk. And so in order to do that, we then teach them the pride skills, what we call the do skills, the things that we want to see them replacing those commands, questions, and critical talk with, in order to improve that relationship with their child, but then also improve the behaviors. I think next. Okay. So the don't skills, are the ones that we want to avoid, are, like I said, the questions, commands, and critical talk. So this is a big thing. I know I was talking with Ashley about it, and a lot of what you guys do is asking some questions, from the child in order to have some of your measurable goals and your treatment plans being met, so you can see those things. We want to avoid those, at least in this first phase. We're going to reduce them, throughout the whole program and their interactions. But a lot of these things are during the session, so the weekly 1-hour session. And then also the parents are practicing every day at home with their child for at least 5 minutes. So they can still ask questions, give commands, and be critical if they want to be, other times in the day. But if we see them reduce these and take these away during the 5 minutes or during the session time, we will see a major improvement in the child's behavior. So why do we avoid questions, commands, and critical talk? Well, a lot of those are very negative, and so they're going to increase the child's anxiety or lower their self-esteem. And so then they're going to act out. It's very hard for children to answer a why question, or, what are you going to do with that? Sometimes they don't know what they're going to do, right? We also want to avoid questions where are unintentional. This is the hardest one for families. It was hard for me when I went through the training. I know Ashley had said that it's hard for her as well. But when we do the inflation at the end of our statement, so we could be saying, that's such a great job, right? And so if we increase at that, we're giving a command. But when we have that inflection, a lot of times the child will hear that as a question, and then they'll say, well, yeah, or they'll be kind of unsure of where that praise or that statement is coming from because of that inflection. So I am hearing that as well. And so I'm taking data and coding the parents. And so when I hear that, that counts as a question. So we want to avoid any unintentional questions, any direct questions, or any hidden questions, so that's like that. Would you like to sit? Well, I might want to sit, but I don't want to now that you just pointed it out to me, right? So that's where we'll have some of that resistance from the children. Commands, right? So again, it's the child led. So they're going to need to follow the child's lead. So if we're giving a command, we have now taken over the direction of that play. And so we do not want the parent doing that in this first phase. And so commands are either direct or indirect, and I'll get to that further on and what we teach in commands, but we want to avoid any commands in this first phase. And then obviously criticism. We don't want to be negative with our children. This is just going to make them feel terrible with that lower self-esteem. It's going to make them not want to engage and play with their parent. Sometimes this is hard for parents when they just don't want to see them fail. So The biggest issue that I find is when they're playing or they're building, the child starts building a tower, but not having a good foundation, right? So they just start building the wall, but nothing to hold that wall up. And so parents a lot of times will say, no, don't do it that way, or stop that. You need to put this here, right? We want to avoid any of that. The child needs to learn to fail in order to succeed, right? And so we want to hold back from telling the child what not to do, and we want to just be addressing the behaviors that are happening in that moment, which then leads us to the do skills or the pride skills. So, sorry, I have a video here, and this is just, it's terrible acting, so I apologize. But here's an example of a parent and a child interacting where she's asking a lot of questions. And so just think about how this would make you feel as the child in this play, and if it is a good, strong relationship, or this would cause some conflict.
Just gonna mute the ad for a second. Yep. Thanks.
You're done? What did you make?
A new box. It'll hold lots of things. On this shelf, it'll hold small things, and on this shelf, it'll hold big things.
What goes on this shelf?
That's just the top. You can put stuff on top.
What goes on the bottom?
Big things. You can put really big things on the top.
Can I turn it over?
Yeah.
What are we going to do next with the train track?
We are going to decorate it with trees.
What do you want to decorate it with?
The trees. The trees can be the forest, but it doesn't seem like we have very much that I have.
Where are the rest of the trees at?
But hey, look, there's a conductor.
What do you think the conductor's name is?
So conductor. Maybe he can cut this tree down and eat it. But look.
What do you think he cut the tree down with?
With an axe, but...
With an axe?
Yeah. Hello.
Hello.
She's not the big baby. She's actually the big sister, and she's the little sister.
Why is she the big sister and she's the little sister?
Oh, because she's smaller and she's bigger.
Oh. Does she really look like a bigger sister?
I don't know. It looks like a baby to me, but it's big to be a baby.
So why would you have her as the little sister then, or the big sister?
She's gonna be the little sister, actually. She's gonna be the big sister. She's gonna be the mom.
Okay.
Okay, so baby, so we are going to dinner.
You're gonna make him eat dinner now? Is it dinner time?
Yes.
It is?
Mm-hmm. That's so really good. What?
So what are they gonna have for dinner? You don't know? They're making chicken?
Mm-hmm.
So is that what they're gonna have for dinner?
Yes.
You guess so?
Mm-hmm.
Are there any more toys that we could get?
Yes, there is.
Oh.
Up, Corinne, you're still on mute.
Okay, sorry about that. So those are basic videos. Again, it's a little corny and the interaction, but that is what we see when they first start. Very uncomfortable parents or caregivers trying to play, but they need that sense of control. What are we doing, right? She said, this is the big sister and the little sister, and he still questioned it. Or he said, I'm going to put the big things on the bottom. And she said, well, what are you going to put on the bottom, right? So it just also is showing that you're not listening to your child. And so these do skills, or the pride skills that we teach them, is going to help build that interaction and lower that need to be asking those questions or being critical. So the first one in pride is praise. We want to have labeled praise for the interactions between the caregiver and the child. What we're going to be doing is giving very specific labeled praise for a positive behavior. Right? So we're not going to be addressing the fact that the child is, maybe frustrated that the tower knocked down. So we wouldn't say, good job not getting frustrated. That's still identifying a negative behavior or interaction. And so we would want to be more specific about the positive behavior and saying, great job calming yourself down, right? So we're going to be addressing the behaviors that we want to see in a positive way to see an increase of that. If we are not being specific about our praise, then we're not going to see an increase in those behaviors. So if we're praising them because they're sitting calmly in their chair, they're going to sit more calmly in their chair. If we're praising them for sharing and interacting with you, then they're going to increase wanting to share and interact with you more. It also makes the child feel good. I mean, who doesn't like to be given praise, right? Sometimes we'll have some feeling awkward or uncomfortable. And a lot of times that's because it's usually coming from a caregiver who the child is so used to being criticized by, right? And so that takes some time for them to get used to hearing that positive interaction, because they'll start to kind of question, like, do you really mean that? And so what we're doing is we're helping the parent or the caregiver do it often and constantly, so that the child is understanding that this really is what we are happy and we want to continue to see. Okay, next slide. I think I gave some examples. All right, and we want to reflect. This is where we want to be repeating or paraphrasing the child's appropriate talk. This is really, really important, because as you saw in those previous videos, all the kids were talking. They were explaining what they were doing. And so then when they're being questioned about it, it's kind of, showing the, children's ability to have high patience and tolerance levels, right? Because it's like, I just told you, I'm making dinner. Of course we're going to be eating dinner because it's dinner time. Like I just said that to you, right? So that when we don't respond and paraphrase what we're hearing them do, then there is going to be an increase in frustration. So a lot of this is really going to just be, having them restate it, but making sure that we're not restating it as a question. And it really is just teaching them to listen. It helps improve their speech and language, right? So if they say something, maybe inappropriately, or they pronounce something wrong, the parent can then reflect it back with the correct pronunciation. It just helps also keeping the child focused and attentive to what it is that they're doing, because then you're having that social interaction back. So if the child is playing and says, I'm going to color the sky blue, the parent will be, reflecting back and saying, yes, you're coloring the sky blue, right? So we're just reflecting right back what the child is saying. Next is imitate. And so this is where we're going to be imitating the child's appropriate play. This is where the parent is going to be doing the same exact thing, and it's kind of a behavioral reflection for the play. If the child is building, the parent is building. If the child is drawing, the parent is drawing. As you saw in that video, a lot of the parents were just kind of sitting there and watching and questioning because they didn't know what to do. So a lot of the coaching that we do in the beginning is just getting the parent to play. Just pick up those blocks, put them down with the child, draw with them. I'm a terrible drawer. So, one thing that I make sure that I share with families, if a child is drawing and doing stick figures, the parent is going to do stick figures. You're not going to one up your child. You're not going to do something better than what they're doing. Yes, you're drawing with them, but the second that you do better or more advanced, that's going to make the child feel, poorly about themselves. And so then they're going to avoid and then just tell you to do it. You just draw me the picture. We want to avoid that. We want the child to be in the lead, taking over what it is that they're doing, and the parent just following behind. I usually have them follow behind by like 1 or 2 steps, and then they're paralleling that play with that child. It lets the child continue to be in the lead and taking the parent from doing that. It helps keep the play at the developmental level of the child so that then the parent is not making it harder than it needs to be. It also is really increasing that social aspect between parent and child, and doing and learning to take turns, to sharing, to having that improved interaction. Next. All right, D is for describe. That's where we're going to be describing the child's positive behaviors that they're actually doing. So this is going to be kind of your sports announcer, your running commentary, where if I were to be kind of closed eyes, I can basically get a visual of what the parent and the child are doing. So teach parents that this is where we want to have you saying you are statements, what the child is actually doing, not what the child might do next or what you think the child is doing. We also are reducing the parent saying what they're doing. I'm going to build a blue tower because you're building a red tower, right? We want to make sure that the parent is really addressing the child's behavior. In doing this, we're going to increase their attention span greatly, because what we're doing is we're describing what we're seeing happening in that moment, which then holds their attention on that activity. It also reduces the need for questions. So if any be skill to replace a question, that would be this describe, the behavior descriptions. So in those videos, the parent would just be describing what the child is doing. You're holding the two sisters. You're putting the two sisters in the kitchen. Then the child would respond with, yes, they're going to be making dinner. Oh, they're making dinner. And then there's that reflection. So it helps build that interaction, but then also reducing any of those negative skills that we're used to doing and we don't want them doing in that moment. Next. All right, and then E for enthusiasm or enjoy. This is just enjoying the time with your child. This is done by, increasing that nonverbal interaction. So smiling at your child, making eye contact. A lot of times I will encourage and coach the parents or the caregiver to do like a gentle touch on the back of their shoulder, connected with the label praise, just making sure they're making eye contact or smiling. Those kids who do not like to be touched, right? They don't have to do those things. It's not necessary to connect that, but just then maybe commenting on, I love seeing your smile, right? And then smiling back. And so you're modeling some of that interaction and that relationship building by just helping them learn to enjoy. All right, so then those are the pride skills. And so in the teach session, I usually will have the parents or the caregiver retell me all the skills and discuss those skills, and if they have any questions. But what I have here are two videos. We could probably just do the one, Ashley, during the play. So this is going to show you what it looks like utilizing all of the skills that I just explained to you during a play.
Can get bigger.
That's very smart of you to know that you can make a gear factory. Now you're putting the orange piece on. Get some more gears out for you.
Color that in there, we put 4 of them for each one of these.
You want to put 4 of each color. So
Yep.
I got you 4 blues there.
Yeah.
And you got out the orange. I like how you're working so hard on this. I like how you know your color so well.
When I turn one, turns all of them.
Yep, when you turn one, it turns all of them. You're making them all turn. Right? Thank you for showing me what you're playing with. And I really appreciate how you're sharing the toys with me.
Wow, see?
Yep, you're showing me how it works. So now you're putting the red one on there. And now you're putting another red gear on there. And now you're putting a third red gear on there. And now you're putting a fourth red gear on there. You're showing me how they all turn. I really like how you're making gears. That is so cool how you're making that. I'm going to make one just like yours. It's so cool. Thank you for being so polite with me. And I like how calm that you're staying while we're playing.
Okay, so that was a, I don't know, like 2-minute video. And the parent had, oh my goodness, if I was coding, probably 8 or 9 behavior descriptions. They probably had 8 or 9 label phrases, and they had probably 6 reflections just in that little bit of interaction. What we're looking for in that first phase, that CDI phase for mastery, is during a 5-minute coding, we are looking for at least 10 behavior descriptions, 10 reflections, 10 label praises. No questions, commands, or negative talk. So in that time, as you saw, in about 2 minutes, they basically could get those skills. So at first, it feels very overwhelming for the caregiver or parent in order to get those skills, because it is talking. You're talking constantly, to your child as they're playing and interacting. And so what I'm doing every single session after the teach is the first 5 minutes of the session, I'm coding them. I'm not saying anything. Then I will start to coach them, and I can make the coaching very specific to the skills that I coded them on. So if they need to increase their behavior descriptions, we're going to really be focusing on that in that session. Or if I want them to be reducing their questions, I'm going to be addressing that with them in session. The other thing too is that very first coach session, I'm not giving any negative feedback to the parent or the caregiver. I'm just going to be encouraging them to play with their child, because it is very overwhelming to remember all of these skills, then interact with their child in front of me when I'm behind the video, and then listening to what I'm saying and listening to their child and playing and remembering all these things. It's very overwhelming. So we want to really start by building that confidence with the parent and just praising and focusing on their strength. And if that means that they just showed up in that day because they had so many questions and criticism and negative talk, then that's where I'm going to be focusing on it. And in doing so, I'm modeling all of the skills, the pride skills, to the parent or caregiver as I'm coaching, so that then they can be kind of restating. So I'll do some line feeding or just learning some of those skills by hearing it. All right, next.
Time for our next code word.
Okay.
Second code word today is pride, like the pride skills we just talked about. So second code word is pride.
Okay. So real quick, because I know time-wise, so handling, negative or misbehavior in the first phase, a lot of it is active ignorance, or like you use an ABA lingo, is that planned ignoring. And so what we're doing is we're having the caregiver or the parent be kind of selective attention, right? And so when we know that there's something that the child is doing that is attention seeking, the crying, the whining, the refusal to play, all of that is attention seeking. And so we want the caregiver to avoid any acknowledgement to any of those behaviors. A lot of this is very hard for families because we'll get the caregiver to be ignoring, right? They're not saying anything, but they're given that parent look, like that mom look of, you're in trouble. You're doing something I don't like, and you're making me uncomfortable. During COVID, this was fantastic because the parent could just put on their mask and then they weren't seeing anything, right? But now that we have, the ability to have no masks, parent needs to be completely ignoring. And so a lot of times I will actually coach the parent to turn away, go walk away, move away, acknowledging that they need to be completely ignoring. The other thing with our active ignorance is that once you start to ignore, you cannot then all of a sudden address the behavior because it's time to go. I have to go to school or work and we need to go. Once you start, you have to finish it until it extinguishes. We know that when we ignore behavior, it will get worse before it goes away. And so that's why we want to make sure that they are identifying that this is something that they can fully ignore until it stops. One way of really being able to do what we do in PCIT is connecting it with the pride skills. So if the child is screaming and crying and yelling because they don't want to go or they don't want to do something, but they're sitting in their chair, we're going to be using our behavior descriptions and label praise for sitting in their chair, ignoring the screaming and the crying, but acknowledging the other positive behaviors that the child is doing. And so when we're saying those things like you're sitting in your chair, I love that you're sitting in your chair, right? Then the child is going to get distracted because we're acknowledging them sitting in their chair. They will start to lower their whining and their crying or stop. The second they do, we're going to praise that. Thank you so much for calming yourself down and talking in an indoor voice. And then we're giving that praise. It increases that behavior, and then they can move on. In the home play, we will have the play stop for any aggressive or destructive behaviors, just because we don't have the parent knowing these skills yet. And so what they would do is say, you hit me. And so a special time is what we call it. We'll stop. I know you'll do better tomorrow. And then they do again the next day. In the session, I will coach the parents to get up, move away, and engaging in the positive skills so that we can see the parent practicing and then avoiding needing to stop. Because a lot of times then kids will learn, oh, if I just hit, then I don't have to do this. I don't want to do this. We want to help build that endurance and that tolerance. Next. All right, PDI, this is that second phase. So once they hit that 10, 10, and 10 in that 5 minutes, and it all is in one session, not 5 minutes one week or 10 in the next week. It is all in that 1 5-minute section that we need 10, 10, and 10. Then we would move into the PDI. This is where we're giving a command. Now, Ashley, I'm sorry, I am going really long here. Do you want me to go through each of them because that's how we have it? Or you want me to just explain the commands because for time purposes?
You can just explain them.
Okay. Like we'll just go through quick. All right.
Yeah.
So we're teaching them how to give a command. So next slide. So there's 8 rules of effective command. Command should be given direct rather than indirect. So this means we want to make sure that we are saying exactly what we want the child to do, not giving them an option. So this is going to be, for example, the please hand me the blue block, right? And not, would you please hand me the blue block? Or can you hand me the blue block? We're being very direct. Giving the very direct command is going to increase that ability to have compliance. Also reduces dawdling, right? So that procrastination. What blue block do you want? Or what block do you want, right? And so being very specific. A lot of times I will also have them increase a nonverbal pointing to the block. No, you're good. You could go to the next one.
Okay, sorry.
So no, it's okay. So the command should also be positively stated. So exactly what we want them to do in the sense of what we don't want them to do, right? So we don't want to be saying stop touching that, right? Instead, we will want to say, put your hands in your pocket. And so a lot of this is just making sure that you're remembering that the child is going to listen to what it is that you're saying. So if you say, don't hit, all they're hearing is hit rather than keep your hands to yourself. So we want to make it positive. Next. The next one is command should be given one at a time. This is very hard for parents because they have a million things on their mind. And they know what needs to be done because they have timelines. We know kids have no sense of time and they think, they have all the time in the world sometimes. But we want to make sure we're giving one at a time. If we give one at a time, it increases our ability to be able to praise them for complying. The more that we're giving them praise for complying, the more they're going to do it because they like being given that praise, right? So instead, we're going to just say, put your shoes on. Once they do that, we're going to praise them. Good listening. Now we can, walk out the door, right? And so then you're just then going to give the next one. Please hold my hand. Thank you for listening. I love when you hold my hand and you listen so quickly because now we're safe. Next. Command should be specific rather than vague, right? This is making sure that they know exactly what we want them to do. Giving the command of, please hand me the blue block versus just hand me a block, right? And so making sure that it's very specific. Next. Command should be age appropriate, right? So making sure that we're talking in a language that the child understands, making sure that we're not saying something that maybe they don't know what it is. the importance of this is because if the child doesn't know, that's when we're going to have that defiance, right? They rather act out, throw a temper tantrum, say no, rather than saying, I'm sorry, I don't understand what you're asking me. They won't say that. They will just act out. So we want to make sure that we're making it age appropriate for that child or developmentally appropriate. Next. We also want commands to be given politely and respectfully. So the best way of doing this, in which I teach families, is to start with the word please. Once we say please, we're also modeling and teaching the child manners, which all parents like when their child is giving manners. And then we can give them, compliments and praise for being able to then model that again. This also helps replace that would, could, can you, when we're saying, please hand me the block, right? Rather than, can you please hand me the block? We take that away. Next. Commands are also where we need to give an explanation before they are given or after the compliance. So this is a really hard skill for families because a lot of times once they get to this phase, they're so excited to be able to give a command, right? And so they just start giving commands. Well, we want to make sure that we're giving a reason for that command, right? And so if they're building together, the parent might say, I am building my tower just like you are, but I need more blocks. Please hand me a blue block. Once the child then does that, then we can give the praise for compliance. So I gave the explanation before the command, why I needed that. And then we're going to give that compliance, praise for that command. If we're going to give an explanation after, it would be something like, please hand me a blue block. The child does that. Then I would say, good listening. Now I can add a block to my tower to make it taller, right? So we're giving that explanation after. In my experience, if we give the explanation before, we have a much higher degree of compliance than giving the explanation after. The reason for that is because we catch their attention. So then they're going to be more likely to be able to listen and comply. And they're not going to ask that question, why, right? So if I just say, please hand me a blue block, they're going, why? What do you need the blue block for, right? Because they're so focused in their play. But if we give that explanation before, we're catching their attention because they're listening to us, and then we can give the command. Next. Commands should only be used when necessary. So we want to make sure we're not giving commands just to give commands. We can a lot of times avoid even needing to give a command by just giving those specific labeled praises for behaviors that they're doing. So the more that we are giving them a praise for playing nicely with their siblings or using their manners or great job getting ready for school on time, as we're doing this throughout the day and throughout our interaction, we will see a decrease in even needing to give a command because they love to make you happy, right? You have your behavior charts or your reward systems. This is where we want to keep doing that and focusing on the positive behaviors. So we won't need to give as many commands because they're already doing it. We're acknowledging and already pointing out when they're being good. So this is then going to help reduce the need for giving commands all the time. Right, next. All right. What we use in PCIT is a 5-second rule, and then we have a whole timeout sequence. I'm not going to get into the details of all that because it's very extensive. But really what we do is the main thing is that we are giving a command and then we're waiting 5 seconds for them to be able to comply. In that 5 seconds, they usually comply. If not, we immediately are giving what we call a timeout chair warning. And in that warning, we are restating the command. So we really are giving them 2 chances. Again, we're waiting 5 seconds quietly. As soon as they comply, we're praising the compliance, such as good listening. We're not going to say, great job handing me the blue block. It is about the compliance that we're going to praise. And then that's when it's going to increase. If they don't comply after the warning, then we go through a whole timeout sequence that is very specific to PCIT protocol. But the main idea about the PCIT timeout, actually go next. I think do I have a slide on that? Nope, I took it out. Okay. Is just that they are in the timeout chair to be quiet, right? Once they're quiet and the parent is acknowledging that they're ready to get off, they then have to still do the original command. They don't just get out of timeout and then they don't have to do what they were told to do. They still have to do it. And then we also utilize a backup timeout space. And so if there's ever a time where the child doesn't stay on the timeout chair, we have a backup space. This is pretty intense for the beginning because the child is learning their tolerance level. Families feel like the timeout space is going to traumatize them because they're being isolated in a space. It is not. It helps actually with their ability to self-regulate and lower their negative emotions from that timeout. So it really is helping them learn to de-escalate themselves in that space. And then when they go to the timeout chair, they know they need to be quiet before they can then leave, and they still need to comply. This takes the power back in the parent-child relationship, because a lot of times, a lot of the conflict occurs when the parent is giving the child too much power and ability to determine when they can get off. And so this takes that back to then increase that interaction. All right, next. So PCIT, why does it work? Oh man, so many things are fantastic about the program, but we see just a lower degree of, defiance from the child. It increases their positive behaviors and interaction. The number one thing is that it's giving the parent and the child their relationship back. It is taking the therapist out of the situation, because a lot of times the kid doesn't even remember that I'm there coaching. And so it really is allowing the child to be good for their parent, not where an outpatient, they can just go to the therapist and the therapist is like, they're doing great. You should be fine at home. And then at home, they're terrible, right? They always say, oh, their true self comes out. This allows them to really be able to be who they want to be. And then we are providing that parent specific skills to address their child individual needs. So it's teaching the parent, it's supporting the parent, it's supporting the child, meeting everybody at their needs, and just really building the skills they already have, but polishing them up and making them stronger. Next.
Me. All right. So as we've been going through this, I hope that all of you have kind of been picking up on the principles of ABA that is being utilized within PCIT as well. So some of those that I picked up when Corinne and I were kind of going through things is one, positive reinforcement is being used through that labeled praise to increase the desirable child behaviors. They do use a punishment system in their timeouts to decrease the negative behaviors by temporarily removing the child from that reinforcing environment. The third one was differential reinforcement, which helps the parents reinforce the positive behaviors while ignoring those minor negative behaviors. They're also utilizing shaping. So they are taking gradual steps towards more complex and socially appropriate behaviors, really teaching the skills to the parent as the program goes through. As Corinne kind of mentioned in the earlier slides, extinction is involved as well. We also talked about that extinction burst, because they are ignoring the problem behaviors. We may have that. And it will decrease the negative behaviors over time. Essentially, Corinne's coaching that she's doing when she's doing PCIT is very, very similar, if not the same thing as behavior skills training, because she's using that modeling, that rehearsal, that coaching feedback in order to reinforce the caregiver's own learning processes by implementing the PCIT techniques. And then the last one is that contingency management. So it's ensuring that the consequences for the behaviors are clear and consistent, and helping the children learn from their actions. So those were the 7 things that I hope, at least a few of those stuck out to you as we were going through. So how could we implement some of these skills in our ABA treatment protocol? Well, we probably are using a lot of what we're doing, but how can we really teach the parents to be able to do that? We're using them in our sessions. I get to observe you guys and I see that, but we can really take this and break it down and use behavior skills training to teach the pride skills specifically to the parents. So we would be that bug in the ear for the caregivers. So how would we do that? So the first for BST, we have instruction, we have modeling, role play, and feedback. All the same things that Corinne is kind of talking about. But for our instruction, we could explain those pride skills to the parent. We're going to focus on using these labeled praises, reflections, and descriptions when interacting with your child in order to improve your positive communication. So we'll also, be able to explain this before we jump right in. We're going to make sure they understand why we're doing it, what we're going to be doing, be able to have a conversation with them to decide, do they have any questions about it? Do they have any concerns? Let them kind of express that in that first instruction step. Once we give the instructions, we're going to do that modeling. We're going to demonstrate how to use each skill with them. So we're going to break that down. We're going to practice the labeled praises, and we're going to show them, for example, while playing with the toys, I'm going to model, I love how you're stacking with the blocks so carefully, or saying, it's such a big tower, wow, that's amazing, and modeling for the parents what that's going to look like. But then once we are finished with just modeling, I feel like this is the part where we could really help the parents more significantly is by practicing those skills with them, not just telling them what to do or modeling it for them, having them practice. So we're going to ask the parents to practice with us. We're going to start with the parents being the kid and the behavior consultant be the caregiver. And so in that interaction, I'm going to give those praise statements to the parent as they're going. I'm going to make those reflective statements as the caregiver the caregiver as the parent. No, the caregiver as the kid is playing. I'm going to be utilizing those pride skills and getting them comfortable with hearing it. The more they hear that, it's going to make it easier when they switch roles with you. And then it's their time to practice. You're going to set up a play situation and you would have them presenting those labeled praises, enthusiasm. Trying to keep the inflection down is incredibly hard. I'm sure you all have noticed that even when I'm talking, just making statements in general. It's a very I don't know, it's a therapy-based thing I think that we all do. My husband has actually told me, you guys all talk the same. You do something, and until Corinne told me, oh man, now I know what he was talking about. So we're going to work on all of those skills in that role play situation. And then finally, the fourth for the behavior skills training is that feedback. Like Corinne said, you want to keep any of that negative feedback from that first session. Really just tell them what they did well, what went well, because they're already nervous. They're already, kind of maybe they're not bought into it yet. And or maybe it's uncomfortable. I don't know about you, but role play situations make me really, really nervous. So that first one, you're going to avoid some of the criticism, but instead you can tell them what they did well. And then again, ask them, how did they feel about it? How, maybe how do they feel about it? Maybe they identify things that they could do better in that situation. And then we can go from there and keep practicing until they feel comfortable to then go back and start the circle over. And now we're going to move to, let's try this with your child. We just did this in a session as a caregiver training session. We feel comfortable. You're using these skills really well. Now let's try it with your kiddo. So that is the end of our kind of conversation about how these skills can be implemented in our sessions. And I do have our third code word, which is practice. So again, third code word, practice. And Corinne, do you have any last minute thoughts?
No, I mean, I've always enjoyed the fact that there's so much overlap, and If you're feeling overwhelmed by all this, please know that it's, completely understandable, but it's doable. I've done a lot of training, staff in this program and have had, ABA staff, become PCIT trained. And so it does take a little bit of, attention and just really stopping to think about these things and then making that change, because everybody's got the ability to do this. And so it really is just being more self-aware. Any questions from anybody or thoughts?
Corinne, can you maybe just talk real quick about the difference between reflecting and describing?
Yep. So describing is going to be stating what you actually are seeing happening that the child is doing in that moment. So that's that you are statement. So you are sitting in your chair. You are holding the blue block. You are placing a red block on. Now you're doing a yellow block, right? So what the child is actually doing is you're describing that behavior, that running commentary. So all your sports fans, right? That is where they are just announcing everything that's going on, where you could basically watch the Phillies play without actually watching the Phillies play because you know exactly what's going on. Reflection is restating, paraphrasing back the child's talk. So when the child is saying something to you, you then are reflecting back what you're hearing them say. That is acknowledging them and then also telling them that you are there, you're present, and then, increasing that interaction and that communication between each other.
Okay. So reflecting is more about their language and describing is more about their actions.
Correct.
Okay. Thank you.
Yep.
Any other questions for Corinne? Corinne, I want to thank you again for coming and joining us.
Thank you for having me.
I could listen to you talk about PCIT all day, and it always makes me think, man, you need to train me in doing it. But we are doing it. This is things that we are doing, and we can take these little nuggets and help our caregivers out.
Absolutely. Yeah. Thank you for having me. I hope that, everybody is able to utilize some of this. And if there's any questions or things that you think of outside and you have, additional follow-up, you know how to contact me. And so you can always do so.
Good. Rob, would you stop recording?
Yep.
Thanks,
Corinne.